Good afternoon. I am Kelly Brown Douglas, Dean of the Episcopal Divinity School at Union Theological Seminary in New York City. I thank you once again for joining us in our series of conversations on being church in the time of COVID-19. Today, I am privileged to have joining me two faith leaders, both of whom serve in the Episcopal Diocese of Navajoland. With me today is Bishop David Bailey and Reverend Canon Cornelia Eaton, who is also a member of the Navajo Nation. Welcome, and thank both of you for taking the time to join me in this important conversation.
Thanks for having us.
Thank you.
I want to jump right in because there's so much to talk about. Here's what we know. This COVID-19 pandemic has laid bare the injustices, inequalities, and sheer atrocities that have been a part of this country's DNA and identity. There is no community of people that have been more on the side of this country's injustices than that of First Nations communities. In this regard, the impact of COVID-19 upon First Nations peoples tells the story of this country's inhumanity to a group of people. And there has been no community more devastated by COVID-19 than the Navajo Nation. So before we get into the details of that story and that impact, some people listening might not know what we are talking about when we say Navajo Nation. And so, Reverend Cornelia, what are we talking about geographically and demographically when we say Navajo Nation?
Yeah, the Navajo Nation is part of 3 states. It's a part of New Mexico, Arizona, and Utah. And part of these 3 states is pretty much in the Four Corners area. But more so, the landscape, the context of the Navajo Nation is mostly Arizona, and a large portion of the reservation is in Arizona. And the outskirts of the reservation kind of tie into the upper Four Corners of New Mexico, and also up in the northern part of, the northern part of Arizona, but the the southern part of Utah. And it expands a large number of miles across the land. And I believe that we're about like 27,000 square feet. Mm-hmm. And so if you think about traveling 27,000 miles square feet from one side to the other side of the Navajo Nation, it could roughly go about 4 to 5 hours.
It's about the size of West Virginia.
About the size of West Virginia.
And so,
pardon me?
I'm sorry, I didn't mean to cut you off. So we're talking about a population of what, about 200,000 or so persons?
On the Navajo reservation, you're looking at least 175,000 to 200,000, but the enrolled members are about at least 350,000. Most of the Navajo live off, part of the Navajo percentage live off the Navajo Nation. So they live in the cities or towns, but at least 175,000 people live on the Navajo Nation.
Great. Now, so the Navajo Nation is reporting numbers in terms of COVID-19 that are only surpassed by New York and New Jersey. Research data suggests that there are more than 3,600 confirmed cases of coronavirus among First Nation tribes, with more than 2,000 of those at least in Navajo Nation. Latest count, I think, was 140 deaths, with Bishop David, 813 cases and 28 deaths alone in your diocese of Navajoland. So we know the data, so we can all look at that. But what's the human story behind these numbers? Reverend Cornelia, what's it look like on the ground?
Right now, we're at the part at a time where our Navajo Nation president is trying to have everybody shelter in place because this virus is continuing to spread, and it's continuing to spread in some of the most isolated areas on the Navajo Nation. And the reason for that is that because of family structure, families that live together. I mean, we're a people of relatives, of clans, of, we share 4 different clans. You know, we are part of our mom's clan, our dad's clan, our paternal grandfather's clan, and maternal grandfather's clan. So there's a huge clan system, and a lot of these relatives live in these certain areas together. Because kinship is a deep part of our spiritual way of life, and it's a big part of who we are as a culture, as our traditional way. So I think a lot of the challenges around this is making sure that people, families, shelter in place and try not to travel long distances to the bordering towns. And so a lot of the grounds right now is trying to get people to stay home. And so that's why a lot of the food resources that are coming in are distributed into the chapter houses, which is, when I mean chapter houses, those are the local government structures in the Navajo Nation. The Navajo Nation is made of the direction under the Navajo Nation and the Navajo Nation president and the Navajo Nation Council. Out of that, there's a spread like a tree. The tree spreads out into these areas that are made up of chapters. And there are about 110 chapters on the Navajo Indian Reservation. And this is spread out throughout. So a lot of the distributions are going to these areas. And so that's what the grounds look like right now, as local communities are trying to help local people, and a lot of support coming in from the outside, trying to help us to look at ways to, as the saying goes, to level out to the virus spread. So
to flatten the curve.
Flatten the curve is the right word. Yeah.
I want to thank you. I want to follow up a little bit with that. With Bishop David, we hear a lot about the comorbid health conditions that have made certain communities more susceptible to the virus, be it heart disease, high blood pressure, diabetes, etc. But what is not as often spoke about are the comorbid social conditions, the conditions into which people are forced by no choice of their own to live. And there's no community of people more than the Navajo Nation that have been forced and relegated to comorbid living conditions. Can you, Bishop David, speak to those a little bit?
There are several factors here that we need to be aware of. One, going back, Cornelia was talking about particularly our church and others trying to make sure that those who are isolated are being fed. There are only 13 grocery stores on the entire Navajo reservation, which is the size of West Virginia. There are a number of convenience stores, like 7-Eleven and gas station, grocery store kinds of things that have primarily processed foods. But quality foods such as fresh vegetables, fresh meat, those kinds of things are not readily available on the reservation. That's a bottom line, which is causing a lot of our folk to have to drive. As an example, our people in Utah have to drive 40 miles round trip to the closest grocery store. Okay. We have conditions where over a third of our reservation has no electricity.
Right.
We have roughly 40% of our reservation has no running water. And so these communities have to go and do a similar thing as they're doing with groceries in terms of accessing water. We're fortunate in our congregation in Bluff, Utah, to have an artesian well that allows us to provide water for communities that are as far away as 50 miles that come and draw water from that particular well. But not everyone has that access. And so consequently, they're still having to do, as some of our folks are doing, having to go and draw water. And they don't have the large containers to hold the water. So they're doing it in gallon buckets and 5-gallon buckets and things of that nature, which the consequence of that is that they don't have adequate sanitation, particularly in the middle of the coronavirus, to be able to wash their hands. And so that's part of our difficulty also, is being able to provide sanitation just as simple as hand washing, which is a difficult thing for us to do.
So
Yeah.
let me ask this. I am struck by the fact that 40% of people on the reservations in Navajo Nation don't have access to water. Yet Navajo Nation borders 80 miles of the Colorado River, yet doesn't have access to a drop of water. Moreover, I'm struck that 1/3 of people in Navajo Nation don't have access to electricity. Yet Navajoland helped create electricity for Los Angeles, Las Vegas, Phoenix, yet families in Navajoland don't have power. Can you speak to that?
I'm not sure that I can speak to it without using expletives.
Yes.
Part of the difficulty that we have in Navajoland is one of the demographic itself. The landscape, if you will, the geography does not lend itself to adequate electricity without huge expense, and or adequate water without huge expense. As an example, I've been bishop for 10 years, and I have been working on trying to replace the well at our congregation at Montezuma Creek at St. John. And the least amount of money that it'll cost us is over $95,000 to be able to drill a well deep enough to provide safe water. And so what we're now having to look at is, can we put a cistern in and haul water from our cistern, from our artesian well, to be able to fill that, so that congregation, which has a 30-mile round trip for water, can have water at least for 3 or 4 weeks, and then we refill it. But again, it's the geography, which part of what leads to that. And it's money. It's not having the adequate resources for the Navajo Nation. I don't know whether you've seen recently the articles about money that was acquired for indigenous peoples that have never gotten to the indigenous people.
That's right.
So that's part of a continuing problem that we have, is being able to provide the nation and other indigenous communities with the resources, and I'm talking about financial resources, to be able to do the things that they need to do. This is not a new problem.
Yeah.
I wish I could say it was just around the pandemic. And that's why I sort of laughingly said I don't think I can speak to it without expletives, because it goes back a long way.
That's right. It's the pandemic has exacerbated the problem. And the irony is, while you talk about not having the resources and the land, et cetera, yet the country, the nation, has used the resources and the land of indigenous peoples for its own privileges and to feed itself. And yet here we find the Navajo Nation and others without their own resources and access to their own land and resources. And so there's just an atrocious and horrifying irony, which leads me, and Reverend Cornelia, I want to ask this question. So when you hear, for instance, that states are opening up that around Navajo land, like Utah, Arizona, and New Mexico, and they all overlap with Navajo Nation. And yet, once again, they're opening up without respect for the crisis and how it is evolving and growing in Navajo Nation. When you hear these states opening up, what are your thoughts?
Well, yeah, thoughts are, obviously anxieties could settle in, and uncertainty, and not knowing that this country has not gotten a handle of the COVID virus as of yet, and I just feel like it's a lack of responsibility on the part of those who want this open states to happen. I think sometimes the lack of understanding, the lack of vulnerability, understanding the vulnerabilities of people that are in this country, and especially in our area, that we're very vulnerable people. Our bodies, our systems are made different than the way a lot of the other folks were created. I mean, I think that indigenous peoples were created in such a vulnerable and a beautiful way, because I think that our bodies are made to live off the land. Our inner resources, our sustenance, is to live off the land, and livestock is our own way of raising up our animals. And so everything that we have, like even the plants, everything is organic. And a lot of that is, we're moving away from that. And I think it's when I hear about the opening of the stores and the cities or the towns, it could also mean that we're not paying attention well enough. I think Creator says to us that we have to pay attention and we have to listen, and that listening, I think, is not happening. We're not listening well to each other, and so those are the concerns that happens. I mean, our indigenous peoples are now accustomed to this way of life now, internet, this fast world that is just moving all the time. And next thing you know, it's one thing after another. And we're moving into that way of life. But sometimes we're also moving away from our culture and our traditions and our spirituality. And I think that we have to remember that our people have struggled for a very long period of time, for over about 500 years now. And we've struggled. We're up against violence. We're up against racism, up against oppression, up against sufferings, even health concerns, even as of today. Many of the people struggle with their immune system. And part of that has to do with the country's, one of the things that I can say is that uranium mines on the Navajo Nation have not been cleaned up. And this was a time when I believe in the World War, that when the atomic bomb was being made, our ancestors were digging these mines, and half of the time they weren't told about them. And so still today, some of that affects the health of many peoples, because it's in the air, we breathe it in, and it causes all these health issues that our people are up against right now. Even just as Bishop David Bailey had mentioned about our food supplies, our health concerns is around mostly foods that aren't healthy. We have mostly gas stations on the reservation, and it's a lack of resources that we continue to have up to this day. And I think that when I was thinking about this, this COVID-19 is really telling a lot.
Yep.
It's beginning to tell a lot about what is really going on in our world, and especially among the underserved, especially among people who are not listened to, especially people who are suffering to this day because of lack of health care, lack of understanding. A lot of justice issues are being revealed right now. And it's all because I believe that we're a hidden people, you know, and that's where I think a lot of our communities struggle with being invisible.
Yeah, I so well said. And I think when you talk about listening, and as people as states open up, and as people clamor for their privileges, they are discounting the lives of others, and not listening to those who are most vulnerable, not simply listening to their voices, but listening to their realities, right? And not listening and caring for the most vulnerable, so that the vulnerable now are becoming disposable. And so whether that's wittingly or unwittingly, we are creating now a culture and saying that certain people are indeed disposable. For instance, we hear politicians say that our elders can be sacrificed or disposable. So I'm reminded of as we talk about this, and to hear you talk, Reverend Cornelia and Bishop David, I'm reminded of the 300-mile-long walk from Arizona to the detainment camps at Fort Sumter, New Mexico, where some 8,000 people or more were held from 1864 to 1868, which is tantamount to the extermination of the Navajo Nation. And it is as if this COVID crisis has revealed the 21st century version of another long walk to extermination, unless someone boldly intervenes, first listens, and then intervenes. And this leads me to the role of the church. Bishop David, recognizing that not only has COVID-19 extracted a disproportionate impact upon Navajo Nation, but also a disproportionate financial impact, even as it is revealed this long history, as Reverend Cornelia so astutely pointed out, this long history of a people who have been made vulnerable and who have been considered expendable. What ought the church be doing? How can the church step in and not only listen, but to boldly intervene, so that in fact we do not continue this legacy of what I call the legacy of the long walk?
You know, the Navajo Nation as an indigenous community is probably the most visible of the invisible. Okay, and particularly now at this particular time. You know, you mentioned the long walk in 1864 to 1868, and there were over 50 long walks in the midst of that period of time, with over 10,000 Navajo and Apache people that were incarcerated there, and that were shot if they could not maintain the trip, and that included women, children, and elders. And if that was the only impact, then you could say, well, you know, that was a time in history, but it wasn't, because then they experienced the boarding schools. And again, it wasn't just the Navajo, it was the indigenous community, you know, the folks that were the founders of this land as a society. And so we had the boarding schools, and then following that for the Navajo, we then had the Livestock Reclamation Act, where the federal government took away over 2/3 of their flock of cattle, horses, and sheep. So as a people, they have continued to experience abuse upon abuse upon abuse. The reason I share that is that that was a political decision by both federal and local governments as to how to deal with the people that were different than they were. In the midst of that, the communities of faith continued to try to reach out, other than a very dark time during the boarding school issue, where some of them were very abusive in their action. But the communities of faith have tried to reach out continually to the people. The Episcopal Church has been involved in the life of the church in Navajoland since 1894. And the Episcopal Church built the first 3 hospitals for Navajo people on the reservation. The first one in 1894, the second one in 1922, and the third one in the early 40s. So the people of faith, the Episcopal Church, has been involved all along in trying to affirm the humanity and spirituality of the Navajo people. What we need to do today is, one, to not allow our indigenous communities to be invisible.
That's right.
We cannot change what was done before us, but we certainly cannot continue to advocate for behavior that is harmful to part of the population. If we believe Holy Scripture at all, and we return to Genesis 1, and we look at the creation story, and we hear that on the 6th day, the Creator created humanity and saw that it was very good. And I'm not hearing the Creator say he invented Anglos or he invented Asians. I'm not hearing that. I'm hearing that he invented all of humanity. And if we are a people of faith, we have a responsibility to respond to that creation. And we have a responsibility to a people that have been deprived and abused and put over.
You say that so well and so powerfully, and we are, one thing that COVID has revealed is that we are interconnected as people across the globe, so that what happens in one part of the globe impacts a person in another part of the globe. That has been clear, but that doesn't mean that we have lived into that. When we think of the Episcopal Church, we think of diocese and a connected church, yet in so many ways we are disconnected, in that not only we may have a history of response to Navajoland and Navajo Nation, but also on our watch, we have this legacy of a long walk toward extermination, as a third of the people don't have electricity or don't have running water, that has left a people, a sacred people, so much more susceptible to an exterminating virus like COVID. And so it's a challenge for the church to be church. And so I want to end with this, as we are up against, there's so much that we could talk about, as we are up against our time. I want to ask Reverend Eaton, what is the challenge for us? What does it mean to be church in the time of COVID-19?
Well, one of the things obviously is living into our baptismal covenant as Christians, as is even the Episcopal Church in Navajoland. I think the Episcopal Church in Navajoland really relates to the baptismal covenant, even the Beatitudes. I mean, I parallel the Beatitudes with our Beauty Way ceremonies. It's not one of those where everything is done away with. Everything is healed, but we learn how to live into the coping way in a healthy way as a spiritual people together, and that we stand up for rights that for our rights, because we are a human being. We are 5-fingered people, they say, and that's what makes us very unique. Our ancestors' spirit is here with us. They speak to us, and we have to listen. we've lived into moving back into their old traditional way of life and speaking our language again. You know, there's a lot of things that we're living into right now, even as a church. And I think one of the things that the way we give back as a church is through generosity. Generosity is an amazing gift, and it's a prayer, and it comes from the heart. You know, my grandmothers and my grandfathers and all our ancestors were generous people because the Mother Earth provided generously, you know, and with the Creator. And so there's all these ceremonies around harvesting, planting, offerings, ceremonies, livestock songs. I mean, our culture is just so rich in so many ways, but we have to remember that the Creator reminds us, but still listen carefully. And that in listening, we learn how to give back. And out of giving back is that generosity of helping this world heal together. Together, it's about the togetherness that we're all a part of in this ministry.
Thank you for that. We are at our time, and I think that that's a good place to end, except to say that this is only the beginning, and I invite people to listen and to listen to those, as Bishop David has said, that have been made invisible, and for the church to listen. Yes, Bishop David.
No.
Oh, and so I invite those who are engaging in this conversation and listening in on this conversation to please listen more to those invisible and most vulnerable voices, because this is where we see the growing impact of COVID-19, even as others may be ignoring those voices. For those of us who care about other human beings, we have to listen to persons like those that are indeed find themselves in these situations of suffering needlessly in places like Navajo Nation. And so I just thank both of you for joining me this afternoon and bringing this aspect of COVID-19 and its impact to the attention of a wider audience. I invite the audience to join me tomorrow, where I will be in conversation with Eddie Glaude, professor of Princeton University, MSNBC commentator, and we will talk more about the race of COVID-19. Thank you for joining us.